when my wife passed, why I wanted to give back. So that's how I got involved with the Senior Companion Program. One of my clients, Leland, I take him to his doctor's appointments. We go walking once in a while. We do a lot of reading. That's given me a reason to do exercises, do more walking. I have to keep myself healthy so that I can help them. I really believe that my clients do more for me sometimes than I do for them.
After I lost my eyesight, I wasn't able to work. Like in my position, nobody would hire me. So I got a little depressed. So I seen the ad in Traders for a foster grandparent. So I told myself, oh, let's go give it a try. I like to see the expressions on the kids when they're doing a good job, or even emotionally, they come and give you a hug in the morning, or it gave me more satisfaction. It gave me a purpose to get up, and I wanted to give my experience, my life experience, to somebody else.
I was a neurosurgeon for close to 25 years. I've done a lot of volunteer work, but perhaps the one that is most satisfying is delivering Meals on Wheels. As a doctor, I think volunteering, especially for an older person, is important to keep them going, having them get out of the house, move around, meet new people. It's healthy for their bodies, healthy for their minds, and it really makes them feel better about themselves and can help forestall some of the depression that occurs in later years.
Before I volunteered, I had a failed back surgery, and I had been on opiates. You know, I just get up and kind of do the same things over and over. And when I started volunteering, now I have all these kids that need help and look to me for guidance. And so I quit my opiates, and it's not just rewarding, but it's helped me tremendously. I get up in the morning, I know I'm going to the school, I know it's like having all these extra friends, and you get to have lunch with them, and just seeing the light come on for kids who aren't understanding something. And you see that light come on when they finally do, it finally clicks for them. So I think that's probably the most rewarding.
So from talking with some of the volunteers about their health, I think the biggest change is their mental health. It gives them a purpose. It gives them a reason to get up in the morning to volunteer and go help another person. And that's whether they're seeing them in their home, or they're helping them on errands, or taking them to the doctor's appointment, or getting, you know, even simple thing like groceries. But it gives them a purpose to get up in the morning. It helps their health, and it also helps the client's health. And that's one great thing about the Senior Companion Program. The Foster Grandparent Program, it's kind of the same thing. It's the mental health of the volunteers, but it gets them out of the house, gives them a purpose, and then they see the love of that child, and they get that love in return for them. And it's just the emotional support and the mental health for them really makes a huge, huge difference.
When I retired, I was like very sedentary. And when I got involved in foster grandparent, I was exercising a lot, walking the hallways, on the go. Being a foster grandparent has helped me a lot in my health, and I've lost a tremendous amount of weight, and it brought all my diabetes, A1C levels down a lot. With the children, you see their success, you see their progress, you see hope in them. It's seeing a child grow up and see them succeed. It's worth it all. And I've come really to appreciate that I can say to myself, I've invested in that child. It has made me feel a lot better about myself.
Yeah, after I lost my eyesight, being a volunteer built up my confidence.
Without foster grandparents, I would probably still be on opiates.
Being a Senior Corps volunteer has kept me active.
And without the foster grandparent program, I wouldn't be where I am now.
To learn more about the health benefits of being a Senior Corps volunteer, visit nationalservice.gov/healthyvolunteers.